Welcome to HealthCast, the heartbeat of health IT. I'm your host, Sarah Seibert. This is the first episode of our Ethical AI miniseries. This series will feature federal AI leaders across civilian and defense agencies discussing the latest developments in artificial intelligence and how they're working to ensure these technologies are fair, transparent, and secure. The use of AI in government has only increased, enabling agencies to draw real-time analytics, streamline services, and even help identify health conditions. However, with the benefits comes risk. Biased algorithms could reproduce existing inequities or embed new harmful biases and discrimination, making ethical development and continuous monitoring essential. To support this goal, the White House Office of Science and Technology, or OSTP, published the Blueprint for an AI Bill of Rights to guide the design, use, and deployment of automated systems to protect the American public in the age of artificial intelligence. In collaboration with OSTP, Dr. Gil Alterovitz, director of the National Artificial Intelligence Institute at the Department of Veterans Affairs, helped establish the framework to provide guidance whenever automated systems can impact the public's rights, opportunities, or access to critical needs. Alterovitz joins us today to discuss the ethical consideration behind AI development, successes from the AI Bill of Rights, recommendations for organizations leveraging AI, and next steps for the new year. So AI is quickly growing across federal government and healthcare. As more agencies and organizations begin to leverage AI, what are some of the ethical considerations that should be acknowledged?
Right. So there's really a lot of things, AI holds a lot of promise, really, when you think about it, for growing the United States economy, improving Americans' quality of life across the board. And, there are a number of systems and they're being explored to help drive decisions and look at things that we've seen in the private sectors. We're now looking at a number of these at the VA. And whenever you look at new ways of doing things, there's always, essentially potentially risks and benefits in that. And so that's what it's important to look at. And ethics in AI is one of those important areas. And so the VA really has taken a leadership role in helping to define the risks and really understanding some of the principles and helping in creating some of those principles to putting guardrails to help prevent any occurrences that may go awry by having that in place at the beginning, right?
Right.
The White House released the AI Bill of Rights in October, and it's looked at a number of different items. And our teams worked together with both with some of these efforts as well as with the across different agencies, coming together with some of the different responsible AI officials through working through interagency kind of forum to really understand what are some of the needs, right? And so when we think about some of these, some of them include transparency, right? So when is AI being used? Sometimes AI is kind of unique in that it can appear to be like a human in some cases. A voice can be generated that sounds just like a human. In fact, it could sound like a particular person. A video could be generated that can look like a particular person who may not have even ever said those words before. Those are just a few examples, right? And so being transparent so that people know when they're interacting with something related to AI is quite important. When you look at the different principles that we've seen from the AI Bill of Rights, there's things around discrimination protections, right? There are things around data privacy that come about, and then having alternatives. So what if you don't want to interact with that AI mode, or you are looking for kind of a different way to another way to interact with a system? Are there potential alternatives? In some cases, there may be ways to do that. And then, as I mentioned, transparency, right? Notice and explanation was one of the key items. So just so that people are aware not only about AI, but what kind of metrics it uses, what kind of data it's based on. All of those kinds of pieces can play a role to understanding how, for example, safe and effective that system is, which is kind of the last of the 5 pillars there that we've been looking at within the VA that came from the Bill of Rights. There are other principles as well from trustworthy AI executive order, a binding order that has 9 different principles. And so we've seen a number of these frameworks come out. There's also one from OECD, which is an international framework. It has another set of principles. And the VA has also some data ethics principles. There are a number of different ones of these. And so what we've done is worked on creating mappings between these to find out what principles are very similar, which ones are different, so that we can have and kind of establish these atomic units that we can then look at and work to establish different ways to move forward, given all of these different frameworks that we want to be able to leverage and learn from.
Right. That makes a lot of sense. And it's been great to watch the progress at VA, especially with the AI Bill of Rights, which we'll dive into later. But earlier in the episode, you mentioned weighing out the risks and benefits when you're implementing AI. I think one of the risks that we've seen are biases. So how is VA mitigating bias as it continues to develop AI solutions?
Right. Bias is it's an interesting and important problem. It's one that certainly we can see in AI. We also can see it in many other areas, right? Because AI relies on underlying data. It also relies on its code. So you can see bias in a number of different places. It could be in the underlying data set that was used. Could be in terms of how the model was designed, how it integrates different data in maybe ways that weren't meant to be done. And so it has been, and it continues to be important to work with all of those different sources, right? So that we can learn and take practical steps. So, we're working within the Data Governance Council, and it has a number of different committees so that we can interact and learn about and leverage some of these different experts across the field, as well as being able to analyze the different use cases for these different issues. We're looking at whether, for example, a trustworthy AI playbook, may be helpful. We're piloting through one of the National AI Institute's centers in Long Beach, a hospital level committee to oversee AI that's going on in Long Beach right now. And that policy just got approved, and there's some interesting work there. And then there are also national level efforts around governance. So as the responsible AI official at the VA, one of the responsibilities is to involve in approving these different plans around how do you ensure that the AI use cases actually meet the 9 principles that I mentioned from the trustworthy AI executive order. And so we have to have a committee that will meet and it evaluates these different use cases and looks at where there may be potential biases. And it's something that then we learn from, right? Because as we look at some use cases, we find patterns, and so then we can make guidance that people, even before they start in the future, they can understand where these can come from, and then hopefully develop solutions so that from the beginning, we can make sure to, in the design phase, look at these. And as I mentioned before, we're also interacting with the other agencies through the responsible AI officials to learn more about how they're doing things, communicate with the lessons that we've learned, then we learn lessons from others. And that's a great way to also be able to understand if there are general patterns that aren't specific to one particular program that's running, but then we can apply it and learn from that to other instances of that overall use case, or maybe even to other use cases.
Yeah, that's great to hear. And to have that governance committee meeting around AI to share multiple perspectives is great, because I think what I've heard is some biases are just unknowing. It comes from a developer who may have a thought or perspective on something and then it makes it in. But to try to cut those out in the beginning is nice. Good to hear. So what are some of the ways you're protecting veteran privacy as you integrate AI into VA workflows and services?
Right. That's a great question. I think that one relates to also the issue, or the kind of the situation that AI is kind of one part of where you'd be involved in protecting veteran privacy, right? There's a lot of areas around protecting veteran privacy. And so there are offices that work on protecting privacy, for example, around the data, right? Around the data parts, or around the when you're doing access to certain types of information when they're when they're logging in, and different ways to do that. So there is that component, and then there are aspects also to integrate specifically that relate to AI, privacy around AI. And those are the ones that, are really, there are a lot of kind of new emerging use cases there. And so what we've done is we don't want to reinvent the wheel, right? We don't want to make a whole new setup just for AI. So we take things that are already there. So I'll take you through an example, which is these institutional review boards, right? Existed for a while, kind of came out a long time ago based after this Belmont report that found that, when you're doing, in this case, research, it's actually, it's important to follow a certain set of principles. And so this board basically evaluates proposals for doing research to ensure that you're using data in a proper way, you're getting consent in a way that the person is understands what they're agreeing to in the research. Again, this is just an example, but there you can see that AI can certainly, and when we have seen it in a number of different research programs, right? And so, but it turns out that these boards, they may not know kind of what questions to ask or what to really be thinking about. So rather than creating a whole new institutional review board process, we created a module that we're now piloting. And at a couple of these, I mentioned the National AI Institute centers, to start with, to pilot and get that feedback about how a module like this would be used, and how we can modify it once it's out there. And we've gotten already some great feedback. And it turned out that actually at one of the first pilot sites, which actually was at the Long Beach, one that I mentioned before, also, it was able to find, in this case, it was an industry-sponsored trial. It was able to find that there was through going through these questions, again, these are kind of optional questions that we're now piloting, it was able to, they were able to find that there was some potential around, issues with transparency, and potentially, you mentioned, privacy, putting that at risk. And so rather than having a whole new process, this process was able to do that by putting in this additional component. And this was tested and compared to other places where the same actual trial was being looked at, and then we were able to learn from the results of what other centers did compared to what this center did with having these additional questions, and they were able to intercept it at this early stage. And so that's been part of the process as has been kind of piloting and learning, so that way we can make sure to protect the veteran privacy in a way that builds on some of the existing efforts. And this is just one of a number of things that are ongoing, but I want to give you one that actually we were able to, we specifically found something related to the transparency and veteran privacy that then it was prevented from occurring because it was done in that early stage when the board, saw it at that center.
Right. That's really exciting. And I look forward to watching how some of those pilots and test sites build on the momentum you all have going with the AI projects in your pipeline. And so we've mentioned this a couple of times, but last year, can't believe we're already in 2023, OSTP, in collaboration with VA, announced its AI Bill of Rights. What are some of the successes you've seen since publishing the document?
Yes, so that was great to see that work that came out from OSTP, and I think we were part of that fact sheet where we had a number of things that we had focused on in that work. We were focused on a number of things around, for example, creating this AI network, and that network within the VA has the ability to pilot and test some of these principles, right? Which we've done. I think I mentioned one of them, right? That institutional review board. I think I may have mentioned the other one also around this oversight committee, a hospital level oversight committee that's being piloted that has policy that's now in place to do that. And there have been a number of other things that we've been working toward that leverage and take on some of that work and building on those successes. So, we've been expanding that network, that AI network, looking to see how to expand that, creating ways to work within within both, within the structures that exist. So I mentioned, for example, the data governance console, some work there, where we have an AI work group that really works together on some of and analyzing some of these and moving forward. And then there's other work that kind of seeks to bring everyone essentially at the VA together. So there's an AI VA community, and what it does is, it has these different clusters, and some of those clusters involve areas like ethical AI. So anyone in the VA can join those and be involved, even if they're, just they're new and they're just interested to learn more. And we've seen quite a bit of involvement, and we've had conferences, and we'll continue to have conferences to also bring people together, both from within the VA and outside the VA. We actually recently, relatively recently, had the conference late last year, which brought together a number of parties. And after that was over, we actually asked the different ones and different people who attended. The summit did it. It's part of this new thing that we call the AI Summit series. Last year's the Brain Summit was a part of that, and we asked, has it increased people's confidence in trustworthy AI at the Department of Veterans Affairs? And 92% agreed, or strongly agreed with that statement at the result of the conference. So we're hoping that by bringing people together, by enabling people to learn from each other, we'll be able to ensure that there is a trustworthy AI and bring about that level of confidence. And finally, working across the interagency, as I mentioned, with other responsible AI officials, we're able to work together and learn from each other.
Yeah, that's really impressive. 93%. Wow. This seems like a great opportunity to plug your last HealthCast episode. So if the listeners want to learn more about the AI network, Dr. Alterovitz joined us last month to discuss. So what advice would you give to organizations that are building out AI solutions to ensure it's trustworthy?
Yes, I think there's a lot to be thinking about here. I think the key, which I alluded to a little bit earlier, is that it's really important. Essentially, prevention is the most important. Like thinking at the very beginning about the design process, intercepting these any issues kind of before they're implemented, and then learning as you kind of keep going, right? So I'll give you an example of that in a little bit, but starting from the beginning, making sure people are aware of the design considerations, and then once it's out there, essentially that's not enough. That's kind of that's necessary, but it's not sufficient. You need to then have monitoring of it. I'll give you an example where we're looking at COVID-19 and looking, kind of within this setting, and to see, before it was used, but just to see kind of in this setting of quality improvement, could you predict things around how the patient would do after a certain amount of time, right? And, at the beginning, it looks like, oh, predictor's doing really well. That's great, right? So you might be like, oh, okay, that's designed well, let's launch this thing, right? But it's important to keep monitoring, right? And before launching, or even, in this case, not launch, but let's say after launching, to keep monitoring, because you always learn new things. So what we learned is that as you got new waves of COVID, the model that worked in the first case may not work as well in the second case, because you've got a different variant. It affects different kinds of patients in different ways, and the geographies changed of where you first created your model in one city versus another city. And so it's important to kind of keep monitoring and not assume that that just because you learned a model one time that it'll always be as effective. It still may be effective, but maybe it won't be as effective, and then you'll be able to understand that. Or it may be that new biases are introduced over time that you want to be careful about. So I think that's kind of the piece. You got to, as I mentioned, first think about from the design stage, but then always be kind of thinking about, are there changes that are occurring over time? Are there new types of data that may be coming in, or are there biases that may be introduced over time? that you want to be thinking about. And then, so how do you do this? I mean, you can have a guidebook or a playbook, or you can have a committee that evaluates these. There are a number of ways to kind of ensuring about some of these aspects, but I think the key is to just realize that it's not like when you think about, usually in contracting, you buy something, you're done, and after you integrate it, you're kind of done until you have to buy the next version for some reason. At least at this stage in the development of AI, and we're not at that stage where you just kind of buy and you're done.
Right, that makes a lot of sense. And VA, or NAII, I should say more specifically, has a great program to bring in some of this innovation and test out new projects. So you all have tech sprints. What role do the tech sprints play in innovating within AI while maintaining ethical and privacy expectations?
Right, right, and that's actually part of the role of the AI tech sprints, which we collaborate with a number of parties across the VA, and in some sprints also across agencies. Are one of the goals essentially of the AI tech sprint is to enable us, as well as the potential collaborators that may be in industry, academia, and others, to be able to see how their AI models or work may work for the VA, or with the data without some of the issues around the ethics and privacy. So how do you do that, right? That's the question. So there's a number of ways to do that. You can use synthetic data. There can be these specialized kind of data agreements. And that's how we basically focus the AI tech sprint on these types of data sets that allow us an ability to learn about how those models could work, because otherwise it's a risk, essentially, of like taking a model that may have worked outside the VA to just use it in the VA, or to introduce researchers to use it. It is a risk because the veteran population is different and may be different from the general population. So there may be essentially biases. It's almost kind of the opposite, in that the general population is sort of biased to being the general population. The VA is a more specific population. Whereas, sometimes you have biases kind of going the other way, which is that you are using a very specific population and it doesn't generalize. But the other way also occurs, and that's why the AI tech sprint is one way to enable us to do that. And the other piece of it is that we learn about the types of things that we want to be careful about in doing that. And a number of these have resulted subsequently, not only in the prize money of the AI tech sprint, but afterwards in contracts. And so we've been working within the VA and parts of the organization to see what kind of language would be interesting, would be not only interesting, but would be useful to put in there to enable trustworthy AI, and that it follows those principles, right? So to ensure that the users of, or that the people who are awarded those contracts, would follow those principles even after the AI tech sprint is over.
Right, that's really interesting. And I definitely look forward to seeing how synthetic data, which you mentioned earlier, plays a role in that. I think that has a lot of potential. So moving forward, what are some of your top priorities when it comes to ethical AI?
Right, right. So there's really a number of key areas, I think, that we think about here. So one is around there, certainly a number of areas, but I mentioned a few before. I'll emphasize a few here. So ensuring equity around AI use and benefits. We want everyone to be able to benefit from it, and we want to make sure that it's used in an equitable way. Another area is enabling transparency on AI use and its associated metrics, right? So many times we'll see different tools. For example, in AI tech sprints, others, they may claim they're 99% accurate in some way, but there are different metrics to measure performance. And it's important to kind of compare an apple to an apple, so to speak. And so understanding the metrics and how to compare them, and so that people are comfortable, and we can increase the trustworthy, essentially the confidence in trustworthy AI use, that trustworthy AI confidence, essentially. And so the other piece to ensuring that trustworthy AI confidence is to ensure that AI is communicated both to the users of the AI, which might be, might be a clinician or something like that, as well as the beneficiaries. That might be the patient or wherever the AI is actually being used. And so as people get to understand and learn more about how it is being used, then they can understand the benefits and the potential risks, just like any new approach when it's being used. And then finally, one of our priorities is really just to help in ethical AI to bring people together and learn from others, right? We see that at the VA, there's some things that we've learned. We've been involved in, you may have seen, there's a fact sheet with there are other countries that we've made agreements with we've worked to learn from their approaches on ethical AI, whether it be in Europe, Asia, other places. And so what we seek to do is to learn from as many places as possible. And one way we're aiming to do that is through the AI Summit series. So this, I guess, after, in September, maybe around after Labor Day, we're planning the next version of the AI Summit series. This year, remember, was the Brain Summit. Next year, it's going to be, the theme's going to be around international health and AI. And this theme of trustworthy AI is one that we really are looking to focus on and to expand on some of the collaborations and approaches that we've been looking at that have been announced that you may have seen. There's one with the U.S.-Israel one that we were in the fact sheet that was a couple months ago. There are other things that are ongoing that would be really interesting to learn from. You may know that there's a number of vendors that we work with also that are international. And so making sure that we learn from them and making sure that also veterans that are in the international sphere also benefit from this work is another area that we're looking forward to in the coming year.
Right. That's all really exciting. And it's been great to watch the momentum over the past 2 years alone. It's been incredible. So thank you so much for joining me for the second month in a row. It's always an honor to have you and hear your take on different topics within AI.
Great. Thank you very much for having me on, Sarah, and looking forward to seeing the rest in this exciting new series. Thank you.
HealthCast, along with GovCast and CyberCast, is a production of GovCIO Media and Research. For more podcasts and to check out the other shows, head to govciomedia.com. Watch out for new episodes released every Tuesday and Wednesday across our shows. You can follow all of them on your favorite podcast platform. And if you like what you heard, make sure to let us know by leaving a review. And if you have any topics you think we should look into, contact us at newsletter@govcio.com.